We're now joined by Dr. Aliyu Elias, PhD financial economist, is joining us virtually this morning. Good morning to you, Dr. Aliyu.
Good morning. Thank you for having me.
And thank you for joining us this morning. Let's start with the bigger picture here. How significant has the increase in revenues, available to state government been since this, bold economic reforms, using the word of the current administration now? And what does it mean for the capacity to address poverty? Dr. Ali, will come to you quickly if you can hear me. But then we're asking the question now, how significant has the increase in revenues available to state government been? I mean, since these economic reforms began, that's been, of course, time in, time out, the presidency has said, oh, governors have more revenues now. And instead of them to go ahead and build more bridges, why not construct roads that are being needed? You have more revenues to work with now. Why? But then the people of the state are also asking, if you say governors have more revenue now, allocations are higher than before, why is our state not better? Why are we not getting, results of this more allocations gotten? Dr. Liu, I understand you're back with us
Right.
now.
Yes, please.
But can you just quickly get into that? How significant has this, increase in revenue have made available to state governments, and when we assess what they've done with it?
Right. So I think there is a serious gap that there is more revenue does not actually translate to better life for Nigeria. And that's the concern of every Nigeria. And that's what we have been raising. Even looking at the first subsidy removal and the money that has been available for Nigerians, it appears that the state governors have much more better share of it. About 10% of the over 10 trillion have been given to them. And if you look at our fact allocation, before the share was 100 billion, now the share 3 trillion within with the state and the federal government. And the concern now is that how does it translate to better life? You recall President Bola Ahmed Tinubu actually raised it that states should stop building flyover and bridges, but to empower Nigerians. I think there's a serious gap from what they are collecting and from what we are actually seeing. But they must raise this caveat as well. The value of 1 billion as at 2023 is not the same value as at 2026 or 2025, as the case may be. It has actually reduced. However, the state governors can now pay salaries according to them. In fact, governor of Edo said we have more money now, clearly stated. But as it translates to better life, I think the major thing is that those money are not invested in where it can better the life of Nigeria. They are not well invested in social infrastructure. So these are the problems we're actually having as a country. And I blame it on the president. And you wonder, why am I taking some national issue to president? You know, you recall the local federal government where there is what we call NEEDS, National Economic Empowerment Development Strategy. It takes it to state. States call it LEADS. SEED, States Economic Empowerment Development Strategy. Local government also use it in that manner. So if the government and the center cannot decipher it.
We'll try to reconnect with Dr. Ali shortly as we're trying to understand all of this. When we say uh, state governors now have more revenue in their pockets and more allocations now, if we even go by the money that was just shared recently, you goes in the last allocations that was read out now, we have even more money, about some trillions of naira that was shared in the last FAC disbursements to states
That
now.
was in July.
In July, right. And then if we have all of those monies, FAC distributing about 3.7 trillion naira to, federal government and state government and local governments, why can't we see the changes? I mean, when you have more money in your pocket, it means that you can do other things. You can do more things. If you could afford to if you could afford to pay for your water, now you can afford to buy petrol. Now you can afford to do other things. That's what more money means. More money means you can do more things. So why can't we, Dr. Liu, if you can hear me
Yes,
now?
please.
So okay, now
Yes,
I'm
please.
just gonna pick up from there with you. And why can't, if the state, federal government says the states have more money now, governors have more money. When you talk about the subsidy, the monies that have been saved from subsidy, these are one of uh, the results they mentioned to say, oh, states have more money now. We paid for NEL fund, and all that. So if state governors have more money, it means more money to do more work. But why are Nigerians and the people of the state not seeing more work being done?
Right. So, and that's what I was actually trying to explain to you
Right.
that Nigerians are at the receiving end of this. There's more money for federal government, state government. What citizens are actually are suffering, and that's why I talked about purchasing power and and disposable income. So, no matter what Nigerians is actually, the federal government is actually earning, it's not getting to the grassroots. It's not getting to the ordinary Nigerian. It does not make sense. So the answer is that the governors are not investing in where poverty can be reduced. As at this morning, World Bank said Nigerian poverty has increased to 63%.
Mm.
That simply means about 140 million Nigeria are now in poverty. So that means the investment are not in the government, the money they are getting as governors, they're not using it on agricultural produce, they're not using it on social infrastructure, they're not using it to actually do what can actually empower people. And that's the problem we actually have. And that's why there must be a direction. And citizens must also not stop calling on federal government at every point in time. We must start beam our satellite on state governments and local governments and start calling them, calling them out. Because if you don't invest appropriately, I recall Niger State when this income started getting increased, he invested in agricultural machine and try to see the tractor he bought and everything he bought month on month. But what about other states? So we must start looking at that direction and calling them that poverty is getting deeper. And poverty that we have in Nigeria is a function of government policy. Policy of first subsidy removal, policy of flotation of naira. These are what we are having. So if you look at it very well, all the macroeconomic indicators appear to be beautiful,
Mm.
to be increasing. Governors are getting more money, but Nigeria are actually suffering. It's because we are missing the right thing that we are supposed to do, which simply means that empower Nigerians. Recall that our interest rate is at 20.5%. That simply means that over 30%. Because you add the asymmetric corridor and everything. Now, student MSME cannot get money to do business. Manufacturing sector are not actually employing Nigerians more because the GDP is a function of service sector, which cannot actually employ. And governments are getting money, they are not investing it into the appropriate way that will benefit Nigeria. And these are the problems we keep talking about. So it's not about the humongous figures federal government is realizing. Citizens actually trading off all what they have, which is a serious problem. Rent has increased, school fees has increased, transportation has actually increased. Nothing is actually coming down as it was. So that's the problem. So there's a serious gap between the government revenue increase and the better life for Nigerians.
When you say better life for Nigerians, empower Nigerians, it seems like instead of empowering more money to the pockets of the state governors, right? Empower Nigerians. How? How can the federal government empower? How can it get to every Nigerian? Because this is, if you look at it from one way, if you empower the states, they can go ahead to empower the local government. Local government gets down to the ordinary Nigerians in the street or in the village or to the small business or the nano business. But now, more money to the state governors. The Nigerians living in the states now do not also feel the more money they have in their state. So how can the federal government empower Nigerians as opposed to sending more money to the pockets of the states?
Thank you so much. And that's what I said earlier, that is about policy decision and President Bola Ahmed Tinubu economic direction. To be fair, federal government has actually done more in terms of giving more money to state governors and giving more money to local governments. Some local government collects as high as 1.5 billion every month. But the problem now is that there's a serious gap, and that's why I said I give example of President Olusegun Obasanjo. You must now start having a direction. In fact, unfortunately for President Bola Ahmed Tinubu, he has over 30 governors in APC. So they can come down and say, yes, we are looking at poverty reduction. So XYZ amount must go into agriculture. XYZ amount must go into MSME. XYZ amount must go into healthcare.
Mm.
This must go into, if there is no direction like that and just give government money on a blanket level, they will continue to build flyover because apparent flyover is what they are competing with now, which does not have direct, impact on reduction of poverty on people. And I must also tell you that the major problem Nigeria is having now, Nigeria is expending over 60 to 70% on food. And that also reflects on our inflation figure, where we have headline to 15.43, and we have food inflation to be 20.31. That's about 5.56 gap between June and July. That's a very huge one. So we have got to know where the gap is. But how do we invest in that gap? The gap could be production of farm produce and distribution of farm produce. In terms of distribution, which is the major problem, there are surplus in some places, there is deficit in some places. How do we actually balance it? In terms of production, a 50 kg of fertilizer is 60,000 naira. How do you now want farmers to go to farm? Farm inputs are becoming more expensive. So these governors should invest in this area. If they invest in this area, this will affect positively the food challenges. Because if myself and you are spending about 60% on food, how are we going to actually cater to transportation, healthcare, school fees, rent? How do we cater to, and that's what is bringing about poverty. I will give you an example of South Africa. South Africa spend around 18% of their income to food. They have about 72% to actually do other things with, and that will give room for savings and other things. So our government must have direction. Without direction, they will give them that money and they will balloon it into white elephant project that does not actually translate to better life for Nigerians.
All right. I hear you on some of the areas that you're saying the governors should focus on. But perhaps the governors, if they are listening to this conversation right now, would say that because of the increased FAC allocation, they've been able to be up to date with payment of salaries. In fact, for some of the governors, they've cleared a backlog of inherited salaries from previous administrations. Some of them are even using it as a campaign tool ahead of the next election to say, look, we've been up to date with salaries. And already before the increased allocation, there was this widespread difficulty or struggle among states, particularly for some of them who were not able to generate enough money on their own. They depended solely on the money from the federal government. But now that it's been increased, what we're now seeing is that the governors are up to date. And would you not consider that, some sort of positive impact of that whole increased allocation?
Well, let me answer you directly. The state that have the highest employment is Lagos State, and it's 100,000. Do you hear that? The state with the highest employment in terms of government workers is Lagos State, and it's 100,000. So, and Lagos has a population of over 20 million. Are you now saying that when you want to cater to the salary of 100,000 people in Lagos, even by extension, maybe perhaps they have extended family, will it be more than 1 million? Where will the other 19 million people actually survive? And that's why we must look at it critically. It's not government workers that need to be catered to. If you don't actually cater to what happened in the market, those people, 100,000 people that got their money, will also go and spend it because of inflation on food consumption. So that's why you will not say because you have more money and you can cater to the need of salaries and wages that other people will actually not matters. So those money federal government is giving you, are they giving you that money only to pay salary? It's not. You have to cater to economic development of people. So salary is just, look at the number I gave you. Lagos State have more than 20 million. But Lagos State workers, which is the highest in Nigeria,
Mm.
is 100,000. So that means others even have less than 10,000.
And
Some
it's
have
interesting that you
15,000.
use Lagos, which is, basically the commercial hub of the country. But there are other states
Right.
where it's predominantly civil servants, who are there.
When you say civil servant, how many numbers? I can tell you no state that farmers and did not triple the numbers of civil servants. Is there any state like that? That we don't have more farmers than them? Is there any state that we don't have MSME than government workers? Some states have only 20,000 government workers, combined state and local government. So you don't use that as the active that you're paying them. That's where you're actually putting the money. The answer is it is not correct argument. So if even though most people say states that are civil servants does not mean that other agriculture, other people that are doing artisans
Mm.
are not there. So it is not correct that and that's the argument we must always bring to table for them. That you don't get allocation from federal government because of only civil servants. And what is the number? Let them bring the figure. And that's why I give you the figure of Lagos that is the highest. So no, in reality, a state that have 50,000 civil servants. And how about your internal generated revenue? Now that you have more money from the federal government. So that we should have shown in a better life for people, invest in agriculture, invest in social infrastructure, invest in healthcare, invest in education and other things. So I think the gap is that we have looked at these our governors and let them alone to do what they want over time. Let them bring the amount they are paying to salary. For salary, I'm not sure it's up to 15% of what they are getting.
Mm.
Where is the remaining 75% or 85%? So, and that's why I said most of them does not have good direction. And I've given you an example of Niger State, who's actually investing in agriculture. I've given you, look at Enugu State. You have to look at all those states that actually are performing. So you cannot tell us that you have more money and you don't know how to. In fact,
Oh dear. Dr. Aliyu, we hope to get you back as quickly as possible because I mean you're an economist and you're in the best position to break down, some of these issues, especially as it has to do with finance, because we see or we hear all of the breakdown from the Federal Executive Council as to the FAC allocations. There's almost like a nominal increase every month. For July, I think it was 3 trillion naira, that was shared between the federal government, the states, and the local councils as well. So it's really important that we begin to scrutinize and find out exactly where it's going wrong. Is it from the federal government who is giving out this money? Is it from the states or perhaps even the local governments who, to an extent, are expected to shoulder some level of responsibility in terms of administration, in terms of governance, in terms of infrastructure, and some of the things that they are supposed to do for the people. But in an event where there's, that gap between the money that is being shared and the impact that has been felt by Nigerians, there's now a whole lot that we should be worried about. Realistically, over the next 2 to 3 years, what should Nigerians begin to expect? What should we begin to look forward to? To say that you're paying salaries alone, that you're up to date with salaries, is obviously not enough. People also, for instance, people who are not civil servants, they also want to be able to have, a reasonable livelihood. They want to be able to go to the market and be able to afford some of these basic things. We're just trying to see if we can get Dr. Aliyu back so we can quickly conclude his thoughts, because obviously, Marianne, the issue of salaries is not the only thing you're expected to do as the chief executive of a state or as a local government chairman. There's infrastructure, there's healthcare, there's education, there's security, there's just a whole lot, that the people are expecting from you. And if the only thing that you can say that you've been able to do is what some people might even call, a tiny fraction of what you're supposed to do, then you might not be doing the job the way it should
I
be
mean,
done.
because if you look at it, you say you remove subsidy, it means that that subsidy money that was going to a select few, you've now removed that money. You say there was a cabal that was, costing, taking more of government money rather than with money meant for the people. Now, the money is now getting to the people. It means that the lives of the people should be better off than what it was with subsidy. So if at this point the Nigerian people are still battling and still asking to say, you said you removed subsidy and you said that was the end of our problems, at least an extent or a move in the right direction, why can't the Nigerian people still feel some relief in their pocket? But rather, the reverse is the case. It's biting harder. The cost of living has increased. The transport money that takes you to work or to your business place has increased. So how do you now understand why subsidy was even removed in the first place? That is one question that Nigerians has been asking. But well, the conversation continues with you. You can let us know your thoughts as well. The phone lines are open. It's 09062029933. Let us know via the text. You can text us. You can go over to our live broadcast on YouTube at the Real Broadcasting Network. On the comment section, you can let us know your thoughts as well as regards to this. States are having more money. The government, federal government says more allocations are getting to the states. Just in July, about 3 trillion naira was shared across federal, state, and local government. So why can't the people of the state of Nigeria feel some sort of relief to say, oh, well, subsidy was really a huge problem, as government say it was. And now that that huge problem has been removed, then we can now hear a sigh of relief to say, oh, finally, here we are. We're good to go. But right after this break, we'll turn our attention to other matters as regards to health. And it's been one matter that should be looked in closely. It has to do with the kidney. You don't want to miss that conversation. So stay, keep it right here on the morning edition, of course, as Real Broadcasting Network.
Every street has a story. Every struggle carries hope. Every dream deserves a voice. We walk where the people walk. We honor our culture. We tell the stories that matter. This is not just news. This is your story, your voice, your network. Real Broadcasting Network. We the people.
We now turn our attention to a disturbing conversation around poverty, desperation, and the human body. Reports of people being approached or lured into selling their kidneys have raised serious questions about what happens when financial hardship becomes so severe to the point where someone begins to see an organ as something they can sell to survive. And beyond the money involved, there are serious medical questions. So what happens to someone who gives up a kidney outside a properly regulated medical process? What are the immediate and long-term health consequences? And how do desperate people become vulnerable to brokers and organ traffickers? Is an extended and expanded conversation, actually. Is it simply a question of individual desperation, or does the emergence of a kidney market point to a much deeper problem around poverty, healthcare, and exploitation? This morning, we're joined by Dr. Ame Sunday, Senior Registrar, Department of Obstetrics and Gynecology at the University of Abuja Teaching Hospital, Gwagwalada. Is also the General Secretary of the Association of Resident Doctors, University of Abuja chapter. Dr. Ame, good morning to you. Thank you so much for joining us this morning.
Good morning, sir, and everyone in the studio.
Morning.
All right. Let's start with a basic medical reality. We hear people talk about selling a kidney almost as if it's simply a matter of giving away a part of you and continuing with your life as usual. What does removing a kidney actually mean for a person's health? And could you give us a sense of how risky the procedure is?
All right. Thank you so much. Unfortunately, that has become a trending issue recently, especially in this part of the world. And we believe that most of the people doing it don't really have the knowledge of why they are doing it. They are just doing it for patients because of probably the economic situation. Now, kidneys, every individual has two kidneys. Kidneys part of the organs of the body like liver, heart, and all, and it plays very crucial role in metabolism, excretion of drugs and toxins, everything that has to do that we consume in the body in terms of drugs and other chemicals are essentially excreted by the kidney. So if they are not working, an individual stands a high risk of having a lot of issues, medically. And of course, because it's an organ that is paired, that we have two of it. One can actually give out one kidney and be able to survive with the another one, with the second one, probably for the rest of his or her life, if the need, warrants it. So because we have two of them, one can sufficiently serve an individual. But what we are experiencing lately is not just what it should be, because ideally we understand that yes, families can be in distress where they need to, to save another family member or somebody that you are compatible with. In such extreme circumstances, one may be required to go out of his way to be able to do that. And but before then, you must have been tested properly to know that your kidneys are actually optimal, so that giving out one will not put you at a risk of, losing yourself completely. But what we see these days is people do it for money, and they are not truly sure of whether even their kidneys are properly optimal before donating one. I don't know whether they conduct some sort of test for them where they do those pack practices. But then one has to be very sure that the second one is very optimal and can serve you the taste of time before you consider, giving out your kidney, and which I believe the reason for giving it out is something that should be crucial, should be family related, or as it deems fit. Well, what we have these days is people, individuals, young boys going to donate it just because of the money for the peanuts that they pay, which I believe will not really even, if they should run into complications, cannot even save them. So essentially, that is not the intention for kidney donation or for kidney transplant, as the case may be. But that is the abuse we see these days. And you can imagine that you give out your kidney, and the second one is not optimal enough to be able to serve you. Then you now start the whole risk of all the functions that the kidney, should provide, will now be jeopardized. And the person comes down with a severe kidney challenge. And of course, if you have chronic kidney disease, you are more or less on your way, to the grave, except otherwise. So I think that is where the sensitization becomes even much important. So for the young people to know that the money that they are being paid for these kidneys that they are harvesting from them is not worth it. The risk of the surgery alone, is a major surgery. It's a very risky surgery that has to be properly planned and undertaken. But what they go through, I doubt if that is essentially done, But I can't really tell because I'm not involved and I don't know the people involved. But in every standard, it puts them at risk, right from from the operation itself to remove the kidney. It can go very badly, and one may not survive it. And if removed, if the second one is not optimal enough, the person is also at risk of coming down with kidney challenge. And when you come down with kidney challenge and you don't have anybody to give it to you, I mean, you are then on your way to the grave. So this sensitization I consider
All
is
right.
very critical, actually. Yes.
Doc, I hear you on some of those explanations and clarifications. Thank you so much. And you just mentioned about the intention. What should be the purpose of a kidney transplant? To say, we may have a family member or a loved one who, might be in need of it. A family might be in a tight space and, that is absolutely necessary. Someone can also argue to say, look, I can't afford my rent. I can't pay my school fees, or I can't offset one important financial need or the other. And therefore, I'm just going to offer up my kidney for sale. I mean, when you hear something like that, can you say the person is making a completely free and informed choice? Remember, you're the one that said they can survive on one. So when somebody decides to do it just for the sake of sorting a financial need, can you say they are making a completely free and informed choice at that point?
All right. Thank you so much. When we say informed decision, Informed decision means that the patient knows exactly the procedure he's going to undertake, the risk involved, right from the operation down to the long-term effect of the procedure he's to undertake. The patient or the person or the client will know exactly what he or she is going in for, and then on his or her own, sign the document. That is what we call informed decision. You as a medical practitioner, you are obliged to explain in detail to the person as to the risk involved in doing the procedure and the risk involved in giving this signal. Yes, because we have two of it, like every part of the body that has two, like the eyes, one can go, one can still, serve you. you know Hand, one can go, one can still serve you. But also, people, I really doubt if these people understand clearly, the implication of what they go into. Because what we see is people being recruited just from the suburbans and, places that people think that, they need money. That clearly defies, the indication for kidney transplant. Ideally, it should be medically indicated. When the family member is distressed, or when, something that has to save another person. Of course, they are trying to save people. But the question is, are these people clearly informed of the decision they are taking? Yes, one may be pressed financially that you may need to offset one or two bills, but are they informed that, okay, donating one of your kidneys when you are not even sure of the functionality of the second one puts you at risk as an individual? I mean, if the decision is freely given, following proper explanation, I may not have problem with that. And then it means that it has to follow the normal required medical consent that we all know. If an individual decides to do that, it's not a problem. But what we see these days is that it has become a hub, like a business, and I doubt if these people understand clearly, because most of these people that we see online, doing this business, if you ask them, they cannot even explain to you what the kidneys are. They cannot even explain to you clearly what the functions of the kidneys are. So I wonder if these people truly and genuinely explain to them and take informed consent from them before they go ahead. But again, everybody has that fundamental right to decide what he or she wants. So if you think you have two organs and maybe for one reason or the other you want to give out one, I mean, so long as you are up to age to make that decision and you clearly understand the importance of that decision and the implications thereof, then I think you can go ahead.
Mm.
But then, as an organ as crucial as kidney to be removed from an individual's body, I feel the person should be properly informed, and which entails everything that we have been talking about. I doubt if this is actually done, or there is some level of exploitation, along the way.
Well, talking about
Thank you.
exploitation, it brings us to the issue of organ trafficking. And in fact, we have some of the numbers here where an estimated 651 kidneys were trafficked and illegally transplanted in Nigeria. This was between 2015 and 2020. And it's not just a Nigerian problem. An estimated 10,000 kidneys are sold annually on the global black market, roughly every hour, based on long-standing World Health Organization linked assessments. Now, when you hear some of these numbers and these statistics, they're quite mind-boggling, and it brings us to the question of this exploitation of vulnerable Nigerians. How can we know the difference between a legitimate, a legal kidney donation, one that has been medically recommended, and a situation where it becomes organ trading or organ, trafficking, as it were? How can we make that distinction?
All right, thank you. In fact, this is where the government also needs to come out clearly on some of the legislations. There's a lot of ambiguity with our government in terms of legislation. Now, it's like we have already established it's not a crime to give out your kidney, but we want to believe that you are doing it, for a reason that you well understand. Now, to avoid unnecessary exploitation, as we saw, maybe probably in the case of the former Deputy Senate President, who, if not because it was on the global stage, if it was Nigeria, nothing would have come out of it. But if it has happened here, I know they would have, told us that it was properly consented and all. Now, there should be established centers. If at all these things should be done, there should be established centers or recognized hospitals that if you are willing to give out your kidney for money, you can approach such hospital, and such hospital have to now cancel you through the process. Probably not only you, if possible, involve your family members to avoid unnecessary and undue exploitation. Because what we see these days is financial inducement. You want to give them 3 million, 4 million, 5 million, as the case may be. Then because of the finance, these people now consent. But how can a child of 17 years, 20 years, 19 years approach your facility without any other person, to also confirm that this decision has been taken and agreed, probably at the level of the family, that he can go ahead, and you now go ahead straight and harvest his organ? I don't think it's proper. So there should be legislation from the part of government, and there should be stricter measures, you understand, so that anybody caught in this act, the law should take it up with the person. And if possible, there should, because again, we cannot shy away from the fact that, kidney related diseases are on the increase. People are dying daily. If you go to kidney centers and dialysis centers, you see a lot of people going through, the pain of dialysis almost every day. And again, people also need to survive. People that have what it takes to buy, if there are people that can give, should be able to buy and also live on. But then all these things should be done within the ambit of the law. That is just the most important thing. Let's have established centers where people can freely move in. You understand? Tell them that you want to donate your kidney either for money or for charity, whatsoever that reason that you want to do it, and you now go through the prescribed, pathway of, counseling, involving maybe your family members or any other person, your guardians, your church people. At least let it not be that the decision is coming from only you, especially if you are a child, and especially if it is not a family related indication for you to donate this kidney. So the government have to come out strong. As medics, we may not be able to, and that everybody is not the same. Because of the quest for money, a lot of people do, because it's a very booming business. So people can do it just to be able to, make ends meet. But again, it is bad. Whatever that is bad, it is bad. So the government has to come out very strongly on this, set up, a clear guideline so that people will know that, okay, if you have a need to donate your kidney, you can approach so and so center where everybody is comfortable that yes, there is issue of kidney, donation in this center, but again, you have to do it following the prescribed guidelines so that people will know that people are not unnecessarily being exploited. Because what we see this day, we feel is exploitation, because harnessing young people who have not even started life and start harvesting their kidney, I don't think is proper, irrespective. So there should be prescribed guidelines and there should be a legislation to that effect, so that even the medical personnel involved will also know that if they do it outside of the conduct that has been prescribed, they're also liable to face the law. I think in that way, we can reduce exploitation as much as possible.
And in
And
fact,
of course, with what people are doing, sensitization, so that these people can also understand the implication of taking these decisions alone.
yeah, and in fact, thank you for mentioning the medical professionals who carry out this procedure. Because we want to assume they are the ones who do the whole process, even though earlier you said some of them may be quacks. Doc, could you tell us if there's any role at all that medical professionals can, play first in making sure that people are not just taking these decisions, and also to be able to call people out or to, draw the attention of the authorities when someone approaches them who's not followed, the right channels or the right procedures, or who might be going about the whole process in a way that they shouldn't. What do you imagine should be the role of the medical professionals in this case?
All right, thank you. I think the medical professionals have huge responsibility to that effect. In fact, the first thing is to keep your oath, or the oath you have taken on the day that you were professed to be a medical doctor. That is a Hippocratic oath, which carries everything. Because if you obey that oath properly to the letter, then you will not do anything that is unjust. You will not do anything that is harmful. It is always the interest of the patient at every point in time. But again, like we said, there are a lot of people who have defied those conducts. Honestly, I will not pretend they have defied those conducts for quest of money or whatsoever thing that they feel. But on our part as medical professionals, the only because this organ, the kidney transplant we're talking about is an extensive surgery. It's not a very minor surgery that you can just grab somebody, take to the theater. This thing requires a lot of preparation. This is something you have to harvest carefully. I say, in fact, it is different when you are doing nephrotomy for maybe a diseased kidney. When you want to save a life, it's different from harvesting kidney, for transplant, because you have to harvest it alongside with all the vitals in terms of blood supply, the nerves and everything intact to be able to transplant it to the next person. So this is a surgery that takes many hours, meticulous surgery. And for somebody to undertake that kind of surgery in your facility, you should also be extremely sure, because the law can catch up with you. But like we said, no matter, because you cannot vouch for everybody. That is just a simple fact. But if we have a law on ground, that takes people up whenever there is, negligence, or whenever they go outside their conduct, then everybody will be reprimanded and be careful in their dealings. But I think the onus lies on the medical professionals more to also uphold their oath of, the Hippocratic oath in which they have taken. That if an individual approaches you or is being brought to your facility just to donate an essential organ as kidney, you should also do your due diligence to ensure that, okay, after you have screened, after you have cancelled, you will have to give the person time to go and think about it and come back, and even come back probably with a family member for confirmation. I'm sure by the time we do all of those things, though the rate at which the issue of kidney harvest is on the increase will reduce drastically. But again, we cannot equally shy away from the bourgeoisie, those individuals that push these medical doctors and medical personnel into tight corner, using a lot of money to entice them. They are the major problem, because they need it desperately. They can pay as high as you can, and these people now go out of their way, because in the end, everybody wants money, everybody wants to be relevant, everybody wants their hospital to actually grow. So again, it's a multifactorial issue. But I feel if one can uphold the Hippocratic Code to the letter, then this thing should be reduced drastically, and the medical personnel have great role to play. And all you just need to do is to do the basic things, that you have been, called to the medical profession to do. Ensure that justice is served. Ensure that the patient, whatever decision you are taking is to the benefit of the patient, and at no point will you consider harm. I think if we're able to do that as basic as that, then this thing will not even be happening in the first place.
All right.
But most importantly, there must be a law to compare people when they err.
All right. And just for a quick clarification of something that you had recommended earlier, you said we should have a center where, if it comes to the point where somebody, needs to donate their kidney, that they can walk into those centers, be properly advised, and then the procedure can be started. But the Nigeria National Health Act of 2014 prohibits the commercialization, as it were, or sale and purchase of human organs. What would you say to that?
Yes, the act prohibits it, but again, the times are changing. And I also feel that our legislation should also be a bit dynamic to reflect the current realities. As at that 214 and now, if you compare the rate at which people are dying of kidney-related disease, I think the difference is huge. And again, we should also look at other crimes. What is obtainable in those places? Yes, I understand that prohibition is needed because, of course, this is Nigeria. If nothing is done to curtail some of these excesses, it can be taken beyond border. But as it stands today, we also have to look at the population of people that are dying of kidney-related disease. What are we going to do? What about the people that don't even have family members to give them, but they have the resources to actually procure it? The law should also come to understand that things change, and therefore things we have to also change with the things. Now, to reflect the current reality and to reduce the exploitation that we are seeing every day, because again, nobody even trusts what these people do for these people. If somebody can mastermind and go in to remove your kidney, who knows what else that the person can do? instead of this quackery, the government can properly legislate it and make it official. Is it not better that people approach a center and when you are talked to, when you are cancelled, you either probably decide that you are no longer continuing, or the people will encourage you not to continue. And if there is a need for you to continue, they will do so. It's better because it will reduce the exploitation. At least everybody knows that.
Considering the economic situation in the country, do you not imagine a situation where we have a trunk of people trooping to those centers, and I mean we may just have a population of people who have only one kidneys in so many parts of the country?
Yes, I understand. But again, without those centers, are people not trudging into other places that we are not aware of? Because it also helps us with statistics as well. Because at the end of the year, if you check the statistic of people that have gone to say I want to donate their kidney, then the government can also look at that statistic and make a policy. But this time around, we don't even have the statistic because these things are hidden. They are obnoxious. So people move in to secret places and do it. And as it stands, we don't have a current data that can reflect the number of kidney transplants that is being done in the country per year. So is it not better we have an established center where the government can look at it, annually and say, okay, last year we had 100 people, came in offering to donate their kidneys, but this year it has tripled. It's now 300. What is the problem? Then we'll now look at the age bracket of the individuals coming. Are they young people? Are they middle class? Are they elderly? In that way, you can now institute policies to address probably the remote cause why people are coming to offer their kidney. Of course, if it's younger people in their 20s, in their early 20s and all, then you can now find that is it because of lack of employment, and then you also look at the geographical distribution. In that way, you can now institute policy. But if that is not done, this factory we're talking about is ongoing massively, but we don't have record to that effect, and there's nothing the government can do. But if we have established center, we can now take statistics, and with such data, we can tell, okay, it's people from so and so geographical location that are coming more, it's people of so and so age bracket that are coming more, it's elderly people that are coming more. Is it reducing or is it increasing? And the ones that have been harvested, how have those ones been used? Have they been used on individuals within the shore of Nigeria, and they actually got better? You weigh the benefit and the merit and the demerit.
Yes.
But what is happening currently, we don't have a data to that effect. Because truly, if 100 people are donating their kidneys per month, per year, assuming, and at the end of the day, we have over 90-something, 80-something people actually getting better from their kidney-related disease.
Dr.
It's a win-win situation for the country.
We're totally out of time. It's not the most pleasant conversation to be had, but we want to thank you so much for your time and for giving your voice to some of these issues. Thank you so much.
You are welcome, sir. Thank you so much for having me.
Dr. Ame Sunday, General Secretary of the Association of Resident Doctors at the University of Abuja, Chapter